I'm going to focus on three areas really. The perceived validity and value of social science, and particularly qualitative social science evidence, how and why such perceptions perhaps can be inappropriately propagated still, and how as social scientists we can most productively contribute to policy making. But I probably need to set some personal context. So I've spent the last decade involved in formal processes of generating evidence to contribute to policy making, environmental policy making in particular. Firstly, as a member of the Royal Commission on Environmental Pollution, and secondly, as a member of DEFRA's Science Advisory Council. And the important thing about both of these is that as a social scientist, I've been involved in what Susan Owens has recently neatly described as interdisciplinary deliberation, characterised by committees where each topic of study or issue of study has involved a combination of technical expertise and specialist expertise, diverse disciplinary lenses, and intelligent lay perspectives. And most of us in these circumstances are lay perspectives at some point. In addition to committee work, I've probably worked over at least 2, if not 3 decades, often as an independent expert, providing social science evidence to government departments and inquiries, usually controversial matters being debated and considered, relating particularly to emerging risks and technologies. So I've experienced sort of firsthand what it means to gather, present, integrate social science understanding of human responses and bring these into policy discussions, to stress, of course, that never actually making a policy decision. That's not the role of people in my position. My own research has often been multi-method, so I have used both qual and quant together, and has also often been intensely deliberative in terms of delivering public engagement around specific issues. And finally, I should say, I have chaired over the last 3 years the social science expert panel of DEFRA and DEC, and that's quite different. Here we see multiple different social science disciplines coming together, particularly to provide advice and challenge to the social science policy and evidence teams in both departments. So let's start with the value and validity of social sciences, and particularly the qual element of social sciences. The Treasury's Magenta book Guidance on Quality in Qualitative Evaluation provides a rather neat summary, I think, of the aims of qualitative research, i.e. to provide an in-depth understanding of people's experiences, perspectives, and histories in the context of their personal circumstances or settings. Goes on to say it is characterised by a concern with exploring phenomena from the perspective of those being studied, with the use of unstructured methods which are sensitive to the social context of the study, the capture of data, following from Ian, the capture of data which are detailed, rich and complex, a mainly inductive rather than deductive analytical process, and answering of the what is, how and why questions. The guidance goes on to note that there are widespread concerns about quality and a shared interest in issues such as rigour, the need for principles of practice to be manifest, the importance of sound or robust qualitative research evidence, and in the relevance and, quote, utility of this research. And as Ian has really introduced, widespread concerns about quality are absolutely not limited to qualitative research. Indeed, the last few years have witnessed an absolute plethora of papers reporting on poor science, and a concern that poor science is more of it is being generated now than in the past. Failures of peer review are manifestly evident in publishing, and the increasing concerns about unreliability in scientific literature, not least caused by systematic bias, are a concern for people certainly like Ian in his role as a government science advisor. But for social science, the problem of questioning of reliability, I think, goes much deeper. In a paper this year in Environmental Evidence, Simin Davoudi, Sarah Watmore, Gemma Harper and myself reflected on the tendency amongst some scientists to consider qualitative methods as somehow inferior to experimental or quantitative methods a priori. From experience and personal experience, decision makers sometimes question evidence that is based on analysis of narrative, discussion and commentary, and suggests that statistical representativeness and reproducibility should be the primary criteria for assessing the quality of research. In my co-authors and my view, these tendencies are not random instances, but rather are indicative of something I think Ian was referring to, the power of relationships within and beyond science, and indeed embedded in the real fabric of knowledge itself, in the social context of science, as Ian referred to. Arguing against these tendencies is absolutely not new. There's a long pedigree of environmental research and policy making where interdisciplinarity demands that diverse framings of a problem and multiple methods of investigation typically must come together and challenge each other in producing new ways of knowing. The Hazardous Substances Advisory Committee of DEFRA has published this year a very interesting paper on their approach to the title Considering Evidence. It is an approach that reflects my own experience in committees very much, one where evidence can include data, information, interpretation, and anecdotal observation, a spectrum of categories of evidence, from experimental through model-based, epidemiological, observational, and narrative. Importantly, a spectrum, whereas the committee points out, where low or poor quality evidence is found in each one of those categories of evidence, and where the important work of any committee of experts is in judging quality, whether the evidence is from what might be determined pure science or from social science. So how have these perceptions of qualitative social science sort of propagated? Well, first I want to note the really fascinating tension between, on the one hand, the widely appreciated understanding of the essential role of social science in policy making, not least around the complex, uncertain, and contentious challenges we face in environmental and technological decisions, and on the other hand, the suspicion that social science evidence, particularly based in qualitative methods, lacks the robustness of other sciences. In other words, the view that social science evidence is indeed necessary, but policymakers don't know how it can best serve society. As Vestry et al. Concluded a paper a couple of years ago, the underlying situation might be characterised as an uneasy truce, or even a Cold War, where qualitative research remains accepted mainly in the context of providing merely nuance for quantitative studies. Here it seems important to stress that no scientific method, or indeed mix of methods, can be judged better or worse than another in isolation from the research or evidence question it seeks to address. So, while statistical analysis might be able to tell us how many people in a local community have installed or not flood defences in their homes, it will not explain how or why individuals made and arrived at the decision to do so. As with all sciences, what causes something to happen may not necessarily explain by the number of times we see it happening. As social scientists, we have to ensure that the relevance of our methods to the question of hand is fully explained and understood. So, if we run a set of focus groups and collate anecdote and narrative about how people perceive and experience their individual and collective responsibility for flood protection, this must not be misused to generalise about the public responses to flood risk, and I absolutely agree with Ian there. This is indeed where challenges around representativeness will be absolutely correct. Rather, social scientists must use such qualitative evidence as indicators of the underlying influences on behavioural response and of the different framings of the issue that may exist in society. If they want their evidence to be taken account of in policy making, they must be clear on the limits of interpretation. And I frequently see reports, not least from consultants, who say the public think something based on a few focus groups. So we are often struggling with the idea of the subjective influences that are affecting our own research. And this is certainly as true of social scientists as any other scientist. But I'll draw here on perhaps on experience more recently when I was a member of the Tree and Plant Health Task Force of government, which was set up in response to the ash dieback, the cholera emergency. Now, in terms of tree health, I am absolutely a lay scientist and definitely have a lay perspective and understanding. As a social scientist, along with two other peers on the task force, I could understand the context in which questions and my opinion were being sought. In that particular case, a very strong media response to the problem, which prompted the scientist to question, the tree health scientist to question, why the public will be concerned about ash trees dying. As one of them said to me, most of them can't tell the difference between an ash tree, an oak tree, and an elm tree, so why are they bothered about them dying? So you count to 10 when you're asked that question, and as social scientists, we should be able to contribute to some understanding of why that may be the case. We, as social scientists in this case, we were able to draw upon the explanatory power of the social amplification of risk framework. And two colleagues, Nick Pidgeon and Julie Barnett, produced a rather excellent synthesis of evidence that was able to respond to that specific challenge and question in hand. We were also, of course, able to articulate the evidence gaps. Importantly, experiential knowledge becomes important in the social amplification framework, and this is frequently the case in understanding public perspectives and responses. While experiential or tacit knowledge, I believe, must be counted as evidence, it is also, of course, essential to collate and synthesize this knowledge robustly. As Patrick noted in the beginning, Sir Mark Walpert, writing in the Times Higher Education last week, not normally the sort of journal where you go to find these sorts of more erudite papers, used the battle to contain Ebola as highlighting the central, and I quote, central contribution of the social sciences and humanities to informed decision-making by national governments and transnational organisations. But he went on to note that we must exercise caution, ensuring that academic input is solely about providing evidence and advice and does not stray into the murkier realms of advocacy. In the government's response published last week to the House of Commons Science and Technology Committee inquiry on advanced techniques for crop improvement, it basically rebuffed the committee's comments that wider public debate on GM is impeded by an insistence that should be impeded by an insistence that decisions are taken solely on scientific evidence, and reconfirmed the view that science-based decision-making, which is based on an assessment of whether or not there is a risk to human health or the environment, is the right policy approach to GM. The government has stated it does not consider that it would be most appropriate to require an assessment of non-safety factors as part of the formal decision-making process. But for me, this seems to fly partly in the face of Sir Mark Walpert's view of the central contribution of the social sciences, which in this instance could absolutely help to understand how to effectively frame communications on GM so as to encourage constructive, open public debate as to the tolerability of different policy options that might be appropriately. And this is absolutely not the same as policy advocacy, but the structured and robust use of appropriate qualitative methods to gather evidence. What we're seeing, of course, is the focusing of risk-based decision-making on the physical risks, with a failure to understand, or rather a propensity to want not to understand, the need for risk management decision-making to be based on the non-physical risks as well. This is a decadal, probably longer, old problem, one I am very used to. And in my view, an entirely inappropriate separation, and one which of course lies at the heart of the continued scientific and policy-making exasperation about public responses to controversial policies. A failure to collate evidence to the underlying framings of public responses, and of course understand how other interests, industrial, scientific, also frame the issue, lies at the heart of a number of societal challenges to technological development. Ultimately, innovation may not be tolerated at a particular point in time for perfectly logical reasons, which have far less to do with concerns about potential risks than when, for example, disquiet about institutional motives and behaviours and perceived threats to things that people value. Seeking to drive policy purely on an assessment of the physical risk, in itself subject to massive uncertainties, ambiguities, and indeed ignorance, will continue to be counterproductive. And I have a sneaking suspicion Andy Sterling will pick up on that tension in a moment. So I think it's the power of Q2 social science that is essential to support this plural treatment of framings and understandings, i.e. evidence approaches which mix complementary quantitative and qualitative methods to understand the how and why of people's responses to, say, in this case, GM. But of course we face another problem still, and this is the late inclusion of social science in policy making and research. Probably less so in policy making now, given the very good mix of advisory committees, etc., and the skill sets that are on them, but maybe in research. And I'm sure that quite a few in the room have suffered the add-on feeling when social science is brought in to deal with what is perceived as an unreasonable or simply unexplainable public response after that response has been noted. Or even worse, social science is garnered to assist in being seen to gather public opinions about a possible policy option. Social science is communication rather than evidence. To make the best use of social sciences, their contribution must, of course, be fully integrated at the beginning of inquiries and at the beginning of research. So I think I've probably come full circle to my personal context. Social science evidence which contributes to interdisciplinary deliberation can absolutely be a highly productive tool in informing policy making. Of course, however, qualitative social scientists have to make sure that the work that they do meets the common criteria of quality. In other words, the aims of what they do must be transparent, the match of the method to the question has to be clear, the interpretation of the data must be open in terms of the error and uncertainty, completeness in terms of enabling a third party to be able to review the evidence and arrive at an independent interpretation of the findings is important, and the data, of course, have to be accessible. Importantly, social scientists as experts, like any other scientist, have to be tested. Their bias is minimized, their accuracy must be high, and their views validated through independent evidence. We must make explicit the sensitivity of our conclusions to uncertainty, assumptions, and caveats. As the Hazardous Substance Advisory Committee report concluded, in matters of controversy, the quality of evidence is itself likely to be a matter for dispute, because this comes part of the process of questioning unwelcome findings. Assumptions, judgments, and biases are likely to be exposed and questioned. So social scientists who bring qualitative evidence into interdisciplinary deliberation of the sort that is essential to policy making around our major global challenges must be open to challenge on their evidence and certainly must avoid the murky realm of advocacy, as Sir Mark Walpole says. We must be sensitive to, rather than simply annoyed by, how our science is perceived, and we must be robust in our evidence gathering and its communication. Thank you.